Welcome to Brooklane's Facebook Live event, Understanding Seasonal Affective Disorder or Seasonal Depression. I'm Kurt Miller, Director of Public Relations for Brooklane. Thank you for joining us. We are offering our Facebook Live events as an educational tool for our community. It's important for us all to be comfortable with our mental health, and learning about mental health is a great place to start that. Brooklane also offers resources on our website, such as blog articles and videos on our YouTube channel. You will find upcoming events on the website also. Please visit us at brooklane.org. Today's program is very timely with the changing of the season, shorter daylight hours, and spending more time indoors. Seasonal affective disorder typically begins in the fall and continues into the winter months. We have Dr. Susan Boyd with us to share about this common condition called seasonal affective disorder. Dr. Boyd works at Brooklane seeing patients on the inpatient unit and is in practice at Family Healthcare of Hagerstown's clinic. She completed her medical degree at the University of Maryland School of Medicine and went on to complete a residency in psychiatry, also at the University of Maryland School of Medicine. Dr. Boyd worked for 10 years at the Baltimore Veterans Administration Medical Center, treating veterans with post-traumatic stress disorder, and addictions issues, and general mental health issues. After that, she worked in Frederick at the Frederick Memorial Hospital and the Frederick County Health Department. Dr. Boyd, thank you for presenting with us today.
Thank you. It's good to be here. Okay, so should I get started?
Absolutely.
Okay, let me just share the screen here. All right, so this is a presentation on seasonal affective disorder, which is a very common problem for people as the seasons change. And it's becoming a problem for people as we get into the fall. This is the time of year when people start to experience the symptoms of winter seasonal affective disorder, which I will tell you more about. Oops. What's going on? Okay, here we go. Seasonal affective disorder, some people call it the winter blues. You might have heard the term the winter blues. That's another term for seasonal affective disorder. So what is seasonal affective disorder? Seasonal affective disorder is a recurrent seasonal pattern of depressive episodes. There's actually, I didn't know this till I started researching this presentation, but there's actually two types of seasonal affective disorder, or I'm going to call it SAD, S-A-D, or SAD. There's winter SAD and there's summer SAD. The symptoms of SAD last 4 to 5 months, whether it's winter or summer, and the symptoms come back year after year, and that's how you know that it's a seasonal thing. It comes back at the same time every year. So you may have gotten depressed one winter, but you don't really know whether it's a winter depression until you have it coming back over and over every winter. So the symptoms of SAD. Well, the symptoms of SAD are symptoms of a typical, what we call in psychiatry, a major depressive episode, which are a depressed mood, low energy, sadness, not enjoying things like you used to enjoy, like you might usually enjoy playing games, watching sports on TV, reading, being with your grandchildren, and you just don't enjoy those things like you used to. You just don't feel like it. You can't get through a book. You can't get through a TV show. It just, even food doesn't taste good to you. You might even feel hopeless, like, why bother? I just don't feel, why go on? You may feel worthless, like I just am not a worthwhile person. I'm not a good person anymore. But there's also sad specific symptoms, and winter sad symptoms are different than summer sad symptoms, and we'll find out about that. So what causes sad? Well, it's different for winter and summer, as it turns out. Winter sad. Well, why do we get depressed in the winter? A lot of people have different theories as to why they get depressed in the winter. A lot of people say it's the snow. I just can't stand the snow. I can't stand shoveling it. I can't stand walking around in it. I hate slipping on it. It's too cold. It makes my feet hurt. I just hate it. It's the snow. That's what makes me depressed in the winter. Other people say it's the cold. I hate the cold. It makes my fingers freeze. I hate bundling up. I like the summer because I can go outside without a jacket on. I just love the summer, and I hate the cold of winter. Other people say, I hate being shut in the winter. I don't like not being able to go places and do things. I hate just being stuck in those four walls. Well, actually, it's not any of those things, or it might be some of those things combined with the real reason. It's the sun. And I'll tell you what about the sun it is. The quality of the sunlight of winter is not the same as the quality of sunlight of summer, and we'll see more about that. The problem with winter is that there's not enough light. The brightness of the sun in the winter is not as bright as it is in the summertime. Even on a bright sunny day in the winter, the sun is not as bright as it is in the summertime. So what are the symptoms of winter sad? Well, first of all, it starts in the fall or winter, and it gets better in the spring. It gets better with travel to southern latitudes, that is closer to the equator. Symptoms of winter sad are what we in psychiatry call atypical depressive symptoms, which are oversleeping instead of having trouble sleeping. People want to sleep all the time. They may sleep 10, 12, 16 hours a day. They may overeat instead of undereating. And in particular, people might have a craving for carbohydrates in winter sad. They may gain weight instead of losing weight with this kind of depression. And they may isolate themselves and kind of hibernate like a hibernating bear. They may just curl up in their bed and just kind of stay to themselves and just pull the covers over their head and just want to stay there for the whole winter. So what about summer sad? What's summer sad like, and what causes it? Well, first of all, what causes it is there's too much light and people just can't stand it. There's too much light and heat, and it drives people crazy. So summer sun makes some people sad. So what about summer sad? Well, first of all, it's obviously the onset is in the spring and summer, and people feel better in the fall and winter. And it seems to be related to the heat and the bright summer light. And there was an article about maybe something having to do with increased pollen counts. There was a correlation of depressive symptoms with elevated pollen counts. Symptoms were different than winter sad. It was kind of the opposite, actually, than winter sad. Instead of sleeping too much, people with summer sad slept too little. Instead of eating too much, the people with summer sad ate too little and lost weight. Instead of kind of being slowed down, summer sad people were agitated and restless and were anxious. So it's kind of an opposite of winter sad. So how is SAD classified psychiatrically? Well, it's not an official psychiatric diagnosis. So if you go to a psychiatrist and say, I have SAD, they're going to say, no, you don't, because it doesn't exist in a way. It does exist, but it's considered a specifier on two other psychiatric diagnoses. One is major depressive disorder, which is what most of us think of as clinical depression or regular depression. And the other is bipolar disorder, or what most of us used to call manic depression. And what we say is that you have major depression with seasonal pattern, or bipolar disorder with a seasonal pattern. So when was SAD discovered? What are the origins of SAD? SAD was first discovered in 1984. There was a National Institute of Mental Health, or NIMS, study of 29 bipolar patients, manic depressive patients, and they reported the atypical depressive symptoms consistent with winter SAD. These symptoms came back every winter and went away every summer. Travel to the north made their moods worse, and travel to the south made their moods better. So what is the treatment for winter SAD? Well, if the problem is not enough light, let's bring on the light. Of the first group of 29 people studied by the National Institute of Mental Health, they used light therapy. They thought the same thing. They thought if the problem is sunlight, they theorized that the problem was sunlight, and they tried bright light therapy. 11 of the patients, about half, not quite half, were treated with bright light therapy, and within 3 to 7 days, their depression got better. When the bright light therapy was stopped, the patients got worse again. So there was a thought that that was a success of the treatment. So what are these, what is the bright light therapy? Well, it's based on the theory that the summer sunlight causes, or lack of summer sunlight causes winter SAD. It's more than, bright light therapy is more than just turning on all the lights in your house. It's more than just going outside in the winter, because the winter sunlight is not adequate to raise your mood. And that's because the angle the Earth makes with the sun in winter is not correct to provide adequate intensity of light to raise your mood. This is a diagram that illustrates why the intensity of light is not enough in the winter time to provide adequate lift in the mood. This is the summertime, and this shows how the Earth is tilted towards the sun in the summertime. The Earth doesn't rotate towards the sun, around the sun, straight up and down. It's tilted. This is the Earth's axis. It's tilted on an axis. This is the North Pole, and this is the South Pole. And this is the Northern Hemisphere, and this is the Southern Hemisphere. And I'm sorry, I couldn't find one that showed North America and South America, but this is where North America would be, or the United States would be. North America is in the Northern Hemisphere. So in the summertime, North America would be up here, and as you can see, it's closer to the sun. It's tilted towards the sun, and obviously the light would be much brighter, leaning towards the sun in the summer months. And what happens is because of the way the Earth is tilted in the summertime, the days are longer, the light is brighter, and the nights are shorter, and this apparently causes some people's mood to be better. Now, this is the opposite. This is wintertime for the Northern Hemisphere. And you can see that the Northern Hemisphere is tilted away from the sun. And it's still daytime here, but the light is not as bright and the days are shorter because of the way the Earth is tilted during the winter months. So the nights are longer, the days are shorter, and the light is not as bright. And people with SAD, their mood goes down. So what is bright light therapy? Bright light therapy consists of using a lamp called a full spectrum lamp. The light is actually white light, but it contains all the colors of sunlight. Sunlight is actually not white. It actually contains all the colors that you could imagine. The full spectrum's lights that are on the market contain all the light of sunlight except ultraviolet, and that makes them safer. That makes it so you can't get a suntan, but you also can't get skin cancer from them. These lights are very, very bright. 10,000 lux. Lux is a measure of brightness. For example, to give you an idea of what a lux is, bathroom lights are like 150 lux, and the lights in Walmart are about 500 lux. So 10,000 lux is very, very bright. So some makers of these lights are Alaska Northern Lights, Northern Light Technologies, Verilux is another one. There are a whole range of prices. They can run from $40 to $500, $600 I've seen. It really varies, but the $40 ones are the ones that I recommend to my patients, and they work just fine. This is a SAD light in action. This happens to be my mother. As you can see, it's quite bright. You don't stare into it. You sit with it at an angle to your eyes and go about your business. Read, play with your phone, drink your coffee, eat your breakfast, do whatever you do. And you need to sit under it 15 to 30 minutes a day, and 5 to 7 days per week. And if it's going to work, it will work within 3 to 7 days. So basically, what do you do with the light? You set it at an angle to your eyes, so you're not staring into it. You can glance at it occasionally. And you can't be walking around the room. I had one patient who set it on a table and was walking around cleaning the room. That's not going to work because you have to be within, one manufacturer said, within 18 inches of the light. So you want to follow the manufacturer's recommendations because the brightness has to do with how far away you are from the light. This is another kind of light therapy light. And, here's me on my computer. You can work on your computer, do whatever you need to do. Benefits of bright light therapy. Well, one is it works fast. It works faster than any medication will work, or most medications will work, I should say. It starts working in 3 to 7 days. What should you expect? If it's going to work, you should experience increased energy, improved mood, decreased drowsiness, decreased fatigue. benefits are that there's no medication side effects, no weight gain, sexual side effects, dry mouth, all those kinds of side effects we experience with medications, you don't experience with this kind of therapy. And I was even able, when I worked for the Department of Veterans Affairs, to get their durable medical equipment department to cover it for patients. I have not been successful. A downside is I have not been successful in getting insurance companies to pay for it. Although I've had patients that have tried, and I've written letters for patients to get them to try to get their insurance companies to cover it. Other downsides, it can cause headache. It can cause photophobia or eye strain. It could cause hypomania, which is too much energy, irritability, agitation. If this happens, you really should tell your doctor, because it could be an indication that you might have bipolar disorder, and you really should get attended to for that. Other treatments for winter SAD. Antidepressants can work, selective serotonin reuptake inhibitors, though that's a kind of antidepressant. You may have heard the names Prozac, Paxil, Zoloft, Celexa, Lexapro. Those are all SSRIs. Another one that's specifically indicated for SAD is bupropion. Another thing that came up in my research was vitamin D. People who are low in vitamin D can get depressed, and that could potentially be a cause of winter SAD. Vitamin D is produced when the sun hits our skin. And if the sun is not as strong, or we're not showing our skin to the sun in the winter time, then we could potentially get vitamin D deficient and potentially get depressed. So if you do have winter SAD, you may want to consider having your doctor test you for vitamin D deficiency. And if you are deficient, follow your doctor's recommendations for supplementation. Psychotherapy can help with winter SAD, and especially cognitive behavioral therapy. Cognitive behavioral therapy is a therapy that seeks to change thinking patterns. It works on changing thought patterns and focuses on coping skills rather than kind of digging up the past. It doesn't seek to look at everything that ever happened to you since you were born kind of thing. It's more on the here and now and how you think and how you can cope with your life as it is. So let's talk about summer SAD. What is the treatment, or what is the prevention for summer SAD? Well, not as much is known about summer SAD. And when I was looking for information for this talk, I could not find as much on summer SAD, and I couldn't find as much on treatment for summer SAD. So I don't, unfortunately, have as much to tell you about that. But the basic premise of it is turn off the lights and cool things down. Basically, with summer SAD, you want to decrease exposure to sunlight. People are recommended to spend time in dark rooms and cool places, like movie theaters, the mall, wear sunglasses, get more sleep if you can, going to the doctor and getting something for sleep if you need to. Antidepressants can help, or psychotherapy could also help. One thing I was wondering as I was doing the research for this talk is with Somerset, is it really mania or hypomania? And I was wondering if the symptoms of agitation and that kind of thing might actually be a sign of bipolar disorder. So I wanted to say something about that. Bipolar disorder can be characterized by euphoria, being too happy or irritable or on edge, talking too much, talking too fast, being hyperactive, just kind of running around, doing too much, staying up all night, cleaning your house, that kind of thing, not sleeping and not feeling tired, doing foolish things like spending $2,000 on the internet on purses or something like that, gambling, doing sexual things you wouldn't otherwise do. If those kinds of things are happening, and we did find when I was working in the hospital that people with bipolar disorder did have a seasonal pattern to their illness. If you're finding that you're having these kinds of things, you really have to be attended to by a specialist. So you should either go to see a psychiatrist or go to your family doctor and get a referral to see a psychiatrist. And that's what I'm saying here. If it is mania, if it is bipolar disorder, I really believe you should seek psychiatric help. Mood stabilizers can help, and mood stabilizers are things like lithium, anti-epileptics, antipsychotics. It's very important if you are bipolar that you get your sleep. It may help to stay away from sunlight to help prevent the manic episodes that go along with the spring and summer, and keep a regular schedule. Diet and exercise might help prevent the disruption in your schedule that may cause episodes. So how to get help for SAD? Well, in an emergency, call 911 or go to the emergency room. That means if you're feeling suicidal, if you're feeling you might hurt someone, or if you've taken leave of your senses, and I don't mean that as a joke, if you really feel like you're losing it, or you're hearing things or seeing things, then you should go to the emergency room or call 911. If it's not an emergency, talk to your family doctor or to a psychiatrist. To find a psychiatrist, you can check with your insurance carrier for providers who take your insurance. Another source of referrals is also your employee assistance program. They can usually find a provider who takes your insurance. If you have medical assistance or Medicare, your local mental health authority or county health department will often be able to make a referral. In Washington County, the Washington County, Maryland Mental Health Authority is available, and I put that number on the screen. Brook Lane has a full compendium of mental health services, inpatient and outpatient, and I've put that number there. Often the local psychiatric society can provide referrals, and the Maryland Psychiatric Society does have a searchable database of psychiatrists accepting patients. And if you want more information on seasonal affective disorder, these are some websites of articles that are about seasonal affective disorder. There are others on the web. And that's it. So I don't know if anybody has questions.
I didn't get any questions in the feed in terms of the presentation, but if anyone has questions, if you care to reply to the Facebook, I can certainly share them with Dr. Boyd. I realized some of the comments, there were some folks that had some difficulty getting in. I apologize for that. I'm not sure what the problem was. But we will have a video of this presentation posted on our YouTube channel, which you can access through Brooklane's website, which is brooklane.org. And that should be available within about 2 days, if not sooner. And so that would be another way in which this material would be available to you to view at that time. For those people on Facebook that are watching it, they do have the ability to share it if they wish to share it with other friends and family, etc. That would be a way to push it forward. I do have a question from Anne regarding vitamin D. Have there been any studies that compared the effectiveness of vitamin D versus light therapy?
Oh, that's a very good question. No, I did not find that. Vitamin D is not specific treatment for seasonal affective disorder, but vitamin D deficiency can cause depression. It can also cause depression that's not seasonal, however. But vitamin D deficiency is more likely to happen in the winter. So that's why I mentioned it in this talk about seasonal affective disorder. So I don't know, that would be a very interesting thing to study, whether vitamin D treatment would be more effective or less effective than bright light therapy.
A question that I have for you about vitamin D, did you see anything in what you referenced or saw in materials, whether there was a reference to, like, there's vitamin D2, there's vitamin D3, that kind of thing?
Oh, I don't know that much about the different kinds of vitamin Ds that there are. The internists use various kinds of vitamin Ds for supplementation, and I don't know, the differences between them very much.
Okay, yes, sorry, I wasn't trying to catch you off guard. I just wasn't sure if what they shared with you made a reference to one or the other. I mean, sometimes people will refer to it as just simply vitamin D and not really to any kind of subset of it, so.
Right.
Any other questions from viewers? Well, Dr. Boyd, I certainly thank you so very much for sharing with us this evening about seasonal affective disorder and expanding on it to the Somerset as well. I think that's been very good and helpful information for people, so we certainly appreciate it.